Welcome to Hospice Talks with RC Hospice Care. My name is Esther Narcissian. I'm one of the founders and the COO of RC Hospice. I'm accompanied today by my directors.
My name's Kimmy Koster. I am the Director of Patient Care Services.
And I'm Timothy Henderson, the Assistant Director.
We have gotten amazing questions from a lot of our viewers from social media, our YouTube channel, and today we're going to be discussing them amongst ourselves to give you a little bit of what our insights are to the questions that you have, and hopefully it gives you a better understanding of what we do, why we do it, and how it benefits you or your loved ones. So one of the first questions is, what is hospice actually? For me, I feel like hospice, the first experience I had was, I didn't even know what hospice was until, I don't know, a year into being a medical assistant. And hospice to me was someone was going to pass away. And usually I thought it was like within 24 to 48 hours, the nurse just goes, takes care of whatever they need to, and then it was the end. But obviously being in the organization for now almost 14 years, hospice is, yes, end-of-life care. So I feel like it's caring still and managing whatever symptom they may have up until they do pass away. What about you?
I think it's a lot of people have experience with home health and they understand the services with home health. I think it is something that is like home health, but much more supportive in the home. So are we sending you out for a urinary tract infection to go sit in the emergency room for 6 hours to get an antibiotic?
That's the worst.
They're not ambulatory maybe, or they're confused. So I think it's something that we are coming out. If it's 1 o'clock in the morning on Friday night, we're coming out to offer those services in the comfort of your own home and providing all those services in home.
So you just said coming to your home at 1 a.m. I think that's another big misconception people have, that hospice is 9 to 5. And that's definitely not what we are or what any other hospice company is. How many times have you gone out in the middle of the night?
Hopefully over 100 to 200 times now. When I take an on-call shift, I might be going out at 1 a.m. I'll get back home, and then I'll be going out again within 30 minutes to go help some of our patients that have some needs.
Give me a scenario of one of the recent ones that you had to go out for.
Recent one was out of control pain. We had a patient, he had a complete bowel obstruction, and that's a very painful hospice diagnosis. So I stayed at bedside for about 4 hours until I could get his pain under control. But that was obviously very rewarding because you could treat his symptoms and make him very comfortable.
Sometimes it's not a clinical need, it's an emotional need for the family. So they're calling, they think that you need to come see grandma, and you're listening to them, and there really is no clinical need for you to go see grandma. But if you go, you're an RN, they trust your judgment, you go out, you do an assessment, it decreases their anxiety, and
Peace of
they
mind.
feel comfortable that she is comfortable and all of her needs are being met.
Absolutely. So another question that kind of matches this question is, how fast can hospice start?
Within 12 hours of the referral. So I have worked here for over 10 years.
We love you.
We get a referral, we will be out the same day. We have never once said no to a referral.
Very
We
true.
have great staffing.
We do, and great directors. They're amazing.
I think we've done an admission up until 1 o'clock in the morning because the patient wanted to get out of the ER and die at home. So we went at 1 a.m. to their house to admit them on hospice.
I think those are one of the most rewarding ones for me. And granted, yes, it does fall along the lines of hospice is the last 24 to 48 hours, but those are, I can say, the miraculous things we've been able to do for people who've wanted to be in their bed or in their home or in their room. Sometimes hospitals will only let 2 or 3 visitors, and especially if you have 50 people who want to be there at your bedside, I think hospice is that beautiful thing that allows that to happen with the care and symptom management in the home. Wouldn't you say?
No, I definitely agree.
So what are some of the services that hospice provides? I know you touched base a little bit, so tell me about the disciplines and all that stuff.
We have a social worker, we have chaplain, home health aide, and a registered nurse.
We also have PTO, TST. We have the medication that we cover, the durable medical equipment that we cover. We have a registered dietitian for some of our patients who are more ambulatory.
Lots of hospice companies do not offer physical therapy.
Oh, absolutely. We know that. Someone asked me once, why do I offer it and why does my company offer it? Number one, I remember Kimmy, who was one of the first nurses I hired, actually. She said, it's something that can benefit people. It gives them peace of mind. It helps them if they're still ambulatory. It helps with blood circulation. But one of the main things was, if my dad was on hospice or my grandfather was on hospice and they wanted physical therapy because they're tired of being in bed all day, or they were tired of not being able to move, or they're even stiff or in pain, would I want physical therapy for them? And the answer was absolutely yes. So we offer it for all of our patients.
Caregiver training. Some of our patients are bedbound, and the elderly wife is trying to take care of them, doesn't want caregivers in the home. She's okay to have our staff there, but we're not there 24/7.
True.
So we can use physical therapy to teach maybe on a Hoyer lift, or how you properly transfer the patient, her husband, from the
Absolutely.
bed into the wheelchair.
Absolutely.
So it's not just for the patient, it can be for caregiver training as well. And I think it's also a good thing to offer, because if they're going on hospice, they don't want to feel like we're giving up and we're not
Absolutely.
doing anything else. So sometimes they don't want to go to hospice because they don't want to throw in the towel and be done and just let them die. So if you can offer those services, that we are trying everything we can to make him comfortable and maintain maybe the strength that he has now is not as good as it was 6 months, but let's try to keep that strength the way it is. Just makes them feel better about the decision.
I love that. You said throw in the towel. It made me think of that one patient who you had met at an assisted living community, and he approached you and asked you for hospice services. And when he reached out to his PCP, who was a younger, newer doctor, the doctor had said to him, "Why are you throwing in the towel?" Even though he was definitely hospice appropriate, he was one of those patients that would qualify for the full benefit, which is a 6-month cycle. I remember the way he even explained it was like, I'm not throwing in the towel. I'm aware of what's happening to me. And because of the education you'd given him, he was ready for the program because he knew he needed those assistants, and he knew he needed that extra support and symptom management, where his doctor couldn't do that. Even though it was easier to go and come, he just didn't want to anymore.
Can you only be on hospice for 6 months?
That's a great question. No, you could be on it for longer. How hospice works is, as long as you have a steady decline, you would still qualify. But because I love what doctors say, they're not God. They can't say how long you're going to stay alive, but it's based off of the prognosis, based off of the disease taking its natural course. If they believe it's 6 months or less, you qualify for hospice. Now, do you always pass at 6-month mark? No, but I have had doctors tell me the patient was going in 4 weeks, and I'm not joking. I think it was like the 5th day, and the patient just beautifully went to slumber. And I can't explain how it happens, when it happens, or how doctors know. Obviously, sometimes it's the diagnosis, it's what you have, the disease process. But then there's other times where the patient I'm talking about, she's 105. She had no problems at all. I was like, doctor, she is not passing away. She passed away. I love that lady. She looked like she was 70, and her daughter looked like she was 50. I was like, where's the fountain of youth? But that's one of our fun stories. Hospice is a beautiful program. If your loved one is declining and they do need hospice services, or the word hospice pops up in one of their doctor's appointments, please reach out for information. Our hospice is an educating hospice. We're always here. If you have any questions or concerns, please reach us at 916-858-1440.